If you are over 60 and you have noticed that your bladder suddenly seems to have a mind of its own, I want to tell you something your doctor might not have mentioned at your last Medicare checkup. Millions of active seniors assume that sudden leaks, urgency on the golf course, or getting up 3 times a night is just an inevitable tax we pay for getting older. But in my clinic, nearly 1 out of every 3 patients who comes in worried about bladder control isn't suffering from a failing bladder at all. They are suffering from a side effect sitting right inside their plastic weekly pill organizer. I am Dr. Carl. I have spent 16 years practicing urology, helping men and women navigate the deeply frustrating world of urinary health. Today, we are looking at 5 common prescription and over-the-counter medications that quietly sabotage your bladder control after 60, including one very popular pill almost every senior takes for nighttime rest that actually paralyzes the very muscle keeping you dry. Pay special attention when we get to medication number 4 on our list, because it is something millions of retirees take every single afternoon without realizing it turns a 30-minute drive to see the grandkids into an urgent dash for the rest stop. Before we jump into the first pill, I want to hear from you down in the comments. How many times are you currently getting up in the middle of the night to use the bathroom, and have you noticed it getting worse over the last year? Tell me your age and your number in the comments below. I read every single comment myself, and your answers directly shape the topics I break down in these videos. Let us start with the first medication on our list, which is one of the most widely prescribed drugs in America, water pills, clinically known as diuretics. If you take a pill like hydrochlorothiazide, furosemide, or spironolactone for high blood pressure or fluid swelling in your legs, you already know it makes you visit the bathroom more often. But here's what is happening under the hood that many seniors are never told. Your bladder is essentially a stretchable balloon made of muscle, and at the bottom of that balloon sits a tight muscular valve called your sphincter. Under normal conditions, your kidneys produce urine at a steady, manageable pace, allowing your bladder to stretch slowly and give you plenty of warning before you feel the urge. When you take a diuretic, it forces your kidneys to dump massive amounts of water and salt out of your bloodstream all at once. It is like turning a gently dripping garden hose into a high-pressure fire hose. The bladder fills so rapidly that the pressure spike overpowers your sphincter muscle before your brain even has time to register a normal urge. This is why you experience that sudden, frantic urge where you barely make it across the hallway in time. Studies published in major urological journals show that diuretics significantly increase both urge incontinence and stress incontinence in older adults, particularly when taken in the morning without proper timing for daily activities. If this is happening to you, one actionable step you can take this week is to review the exact time of day you take your water pill with your pharmacist or doctor. Taking your diuretic early in the morning rather than late in the afternoon can help ensure the rush of fluid happens while you are awake and near a bathroom, rather than waking you up 4 times a night or striking while you are out on the golf course. Just remember, never stop taking a prescribed blood pressure medication or diuretic on your own, as these drugs are crucial for your heart and kidney health. The second pill that commonly triggers bladder trouble in seniors is a class of blood pressure and prostate drugs called alpha blockers, along with certain calcium channel blockers like amlodipine. You might know alpha blockers by names like doxazosin, terazosin, or prazosin. These medications work by relaxing the smooth muscle tissues in your blood vessels so your heart does not have to work as hard to pump blood. That sounds great for your blood pressure, but here's the catch. Your body uses that exact same type of smooth muscle tissue to construct the urinary sphincter, which is the muscular gate that keeps your bladder closed tight. When an alpha blocker circulates through your system, it does not just relax the muscles in your blood vessels, it relaxes that urinary gate as well. For a man with an enlarged prostate, relaxing those muscles can help urine flow more easily. But for many women, and for men with naturally weaker pelvic floor muscles, this relaxation turns a secure seal into a loose valve. Suddenly, every time you cough, laugh at a joke, lift a grandkid, or swing a golf club, small amounts of urine leak out because the gate simply cannot hold against the abdominal pressure. Research from the American Urological Association highlights that alpha blocker therapy is a well-recognized contributor to stress incontinence in seniors. If you suspect your blood pressure pill is loosening your bladder control, your action step this week is to track when your leakage happens in relation to when you swallow your tablet. Write down the pattern for 3 days and bring that short log to your next physical. Your doctor may be able to switch you to an alternative class of blood pressure medication that protects your heart without compromising your bladder gate. Never make adjustments to your blood pressure regimen without direct medical supervision. Quick pause right here. If this information is helping you connect the dots about your own health, please tap that like button below. It takes half a second, but it tells the system to share this video with thousands of other seniors who might be quietly struggling with this exact same issue. And let me know in the comments, have you ever suspected that one of your daily pills was affecting your bladder? Or is this the first time you are hearing about it? Now let us move on to the third pill on our list. And this is one that catches millions of retirees completely off guard. Over-the-counter sleep aids and nighttime allergy medications that contain diphenhydramine. You might recognize this ingredient in brand-name sleep formulas, nighttime pain relievers, or standard allergy tablets that you buy right off the shelf at your local pharmacy. Many seniors take these pills every single night to help with insomnia, thinking that because they do not require a prescription, they must be completely harmless. But diphenhydramine is what doctors call a potent anticholinergic drug. In simple terms, it works by blocking a chemical messenger in your nervous system called acetylcholine. Acetylcholine is the exact chemical your brain uses to tell your bladder muscle to contract and squeeze urine out when you want to go. When you block that chemical night after night, two dangerous things happen to your bladder. First, the bladder muscle becomes sluggish and loses its ability to squeeze strongly. Instead of emptying completely when you go to the bathroom before bed, your bladder only empties halfway. You walk back to bed thinking your bladder is empty, but it is actually still half full. Within an hour or two, that remaining urine builds up to the top, causing what urologists call overflow incontinence. You wake up with an urgent need to go, or worse, you experience quiet leaks while sleeping deeply. Clinical reviews from major geriatric medical societies explicitly warn that anticholinergic sleep aids dramatically increase the risk of urinary retention and nocturnal wetness in adults over 65. If you are using an over-the-counter sleep aid containing diphenhydramine or doxylamine every night, your action step for this week is to phase it out in favor of non-pharmacological sleep hygiene practices, or speak with your primary care doctor about safer, non-anticholinergic alternatives for sleep. Always check with your healthcare provider before stopping any regular sleep aid, especially if you have been taking it for months. That brings us to pill number 4, the medication I warned you about earlier in the video, prescription sedatives and anti-anxiety medications, specifically a class of drugs known as benzodiazepines. Common names in this category include lorazepam, alprazolam, and diazepam. Millions of seniors are prescribed these medications to manage anxiety, muscle spasms, or severe sleep disruption. While they can be effective for short-term nervous system calm, they exert a profound twofold effect on your bladder mechanism. Your bladder relies on a constant, subtle dialogue between the nerves in your pelvic floor and the control centers in your brain. As your bladder fills, those nerves send faint signals to your brain saying, "I am filling up, but we are fine for now." When the bladder is full, the signal gets stronger, prompting you to comfortably walk to a bathroom. Benzodiazepines depress your entire central nervous system. They dull those sensory nerve signals, meaning your brain fails to register that your bladder is reaching capacity until it is dangerously overstretched. At the same time, these medications act as powerful muscle relaxants throughout the entire body, softening the tone of your pelvic floor muscles. The result is a perfect storm. You do not feel the urge coming on until the bladder is completely full, and when you finally do feel it, your relaxed pelvic floor muscles lack the tone needed to hold back the sudden wave of urine. You end up having severe urge episodes on road trips, during dinner at a restaurant, or right as you arrive at your front door, struggling with your house keys. A comprehensive review in the Journal of Urology noted that sedating medications are among the leading pharmacological causes of functional and urge incontinence in older populations. If you are taking a prescription sedative and experiencing sudden bladder leaks, your action step this week is to start a conversation with your prescribing physician about whether a gradual, supervised taper or a non-sedating anxiety management strategy might be appropriate for you. It is critically important that you never stop taking a benzodiazepine or anti-anxiety medication abruptly, as sudden withdrawal can cause serious medical complications. The fifth pill on our list is prescription opioid pain relievers and heavy muscle relaxants. Medications like hydrocodone, oxycodone, or tramadol are frequently prescribed following joint replacement surgeries, chronic back pain episodes, or severe arthritis flare-ups. While these drugs are designed to block pain signals in the spine and brain, they have a notoriously heavy impact on your digestive and urinary tracts. Opioids cause severe slowing of the smooth muscles in your bowel, leading to significant constipation. You might wonder what constipation has to do with your bladder, but the anatomical link is direct and undeniable. Your rectum sits directly behind your bladder in your pelvic cavity. When you are severely constipated, hard stool collects in the rectum and expands, pressing hard against the back wall of your bladder. This physical compression reduces the total volume of space your bladder has to expand. It is like placing a heavy rock inside your bladder cavity. As a result, even a small amount of urine makes your bladder feel completely full, leading to intense frequency and urgency. Furthermore, opioids blunt the bladder's sensory nerves, causing incomplete emptying. You end up with a bladder that cannot hold much fluid and cannot empty what it has, resulting in frequent dribbling and small leaks throughout the day and night. Resolving underlying constipation often dramatically improves bladder capacity and control within days. As always, consult your doctor before modifying any prescription pain management plan. To see how all of this comes together in real life, consider the story of a patient I treated named Arthur. Arthur was a 72-year-old retired civil engineer living near Sarasota, Florida. He was active, loved playing 18 holes of golf 3 mornings a week, and spent his winters taking long road trips with his wife to visit their 3 grandkids in Georgia. But over the course of 6 months, Arthur found himself shrinking his life. He started refusing golf invitations because he was terrified of having an accident between the 6th and ninth holes. He insisted on driving the motorhome instead of taking his sedan on road trips, just so he would always be near a toilet. He was frustrated, embarrassed, and convinced that his body was simply breaking down due to age. When Arthur finally came into my clinic, he brought a gallon zip-top bag filled with his daily medications. We did not throw out his medications. Instead, we worked closely with his primary care team to adjust the timing of his diuretic, safely phased out the OTC sleep aid in favor of better sleep habits, and switched his blood pressure drug to a class that did not relax his urinary sphincter. Within 4 weeks, Arthur's severe nighttime urgencies dropped from 4 times a night to just once. Within 2 months, his daytime leaks completely stopped. He got back on the golf course, took his road trip to Georgia without planning every pit stop, and regained the confidence he thought he had lost forever. If Arthur's story sounds familiar, here is tonight's plan. 3 simple, concrete steps you can take starting right now to regain control. First, gather every prescription bottle, supplement, and over-the-counter pill you take and place them in one spot. Second, check the active ingredients on any sleep aid or nighttime pain product for diphenhydramine or doxylamine. Second, print out a full medication list or write them down clearly on a piece of paper. Fourth, call your pharmacist or primary care doctor's office and schedule a dedicated medication review appointment specifically to discuss bladder side effects. Third, keep a simple 3-day bladder diary, writing down what you drink, when you take your pills, and when you experience leaks or urgent trips to the bathroom, so you can show your doctor exact patterns rather than general guesses. Now that you know how common medications can trigger bladder leaks, there is another hidden culprit lurking right in your kitchen that almost no one talks about. In my next video, I am going to reveal the 3 popular morning beverages, including one marketed as a healthy anti-inflammatory drink for seniors that actively strip the protective lining of your bladder and cause severe phantom urgencies all day long. I am Dr. Carl. Stay well, and I will see you there.